Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today with Governor Janet Mills. Governor Mills and I are going to provide everyone an update on the COVID-19 situation across the state for today, Friday, May 22nd, 2020. And today's update unfortunately begins on a somber note. The Maine CDC is now reporting 2 additional individuals across the state who have passed away with COVID-19. One was a woman in her 80s from Kennebec County. The other was a woman also in her 80s from Aroostook County. The passing of these 2 individuals marks the 74th and 75th deaths associated with COVID-19 across the state. We, all of us at the state, send our deepest condolences to the families of these 2 individuals during this time of their grieving. May their memory of their lives be with them always. Overall, Maine CDC is reporting 1,948 cases of COVID-19, an increase of 71 cases since yesterday. Of those 1,948 cases, 1,749 are laboratory confirmed. 199 remain probable, which is the same number as yesterday. I'll pause on that increase right now to go into a bit more detail as to where those additional 71 cases are from, because that marks another significant increase. Part of it is allowed for by the expanded testing capacity that Maine CDC's laboratory here in Augusta brought on not too long ago. As a result of that expanded testing capacity, we have now started moving toward offering or recommending universal testing in congregate living settings after just a single confirmed case. We put that into action about 48 hours ago when we became aware of a single confirmed case of COVID-19 associated with the Cape Memory Center in Cape Elizabeth. Yesterday evening, we received the results from that universal testing and found that there were a total of 57 individuals associated with the Cape Memory Care Center who had tested positive. Of those 57 individuals, 45 were residents and 12 were staff members. Given that significant outbreak, we immediately went into our emergency preparedness operations plan. Our first and primary goal in situations of that nature is to ensure that we provide quick, prompt care for everyone associated with that center, both residents and staff alike. Within a matter of about an hour and a half, we had pushed out an emergency supply of PPE, including N95 masks, surgical masks, gowns, gloves, hand sanitizer, and sanitary wipes across the agency to the Cape Memory Center. Last night, we had a call with the management and the officials at Cape Memory Center to talk about their staffing needs, the overall epidemiology, provide any assistance we could on infection control, and chart a path forward. We continue to work very closely with Cape Memory Center as we now look to investigate how the outbreak started and what steps could be put into place to prevent similar outbreaks in the future. We thank our colleagues there for their quick partnership with us. We do look forward to continuing working with them. Overall, there are 240 individuals who have been hospitalized, an increase of 5 since yesterday. Right now in Maine, there are 45 individuals who are currently hospitalized, 21 of whom are in intensive care units, and 12 of whom remain on ventilators. As I noted a moment ago, there have sadly been 75 individuals who have passed away with COVID-19 and 1,192 who have recovered, an increase of 47 recoveries since yesterday. Overall, of our cases, 441 have been among healthcare workers. A quick update on our activities at our lab. As I've noted not long ago, we expanded by over 3-fold the Maine CDC's capacity to conduct COVID-19 testing. Earlier this week, we announced that because of that expanded capacity, we were able to remove the prioritization tiers that Maine, as well as many other states, had in place that were needed to preserve the necessary laboratory chemicals that are used to do the test. All along, our teams of medical epidemiologists and infectious disease experts had been studying data about whether we could or should move toward universal testing at an even lower threshold. Previously, that threshold had been set at 3 cases, which constitute an outbreak. But because of that expanded laboratory capacity that we now have, Maine CDC is now moving to offer and recommend universal testing for facilities at not 3 cases, but 1 case. This is for settings where there are congregate care settings at play, not necessarily for all settings, but those in which individuals come into close contact, as well as have a number of outsiders, such as healthcare staff, who are frequently interacting with those visitors. All of this has been made possible because of the expanded laboratory capacity at the Maine CDC lab. As an example of that, just yesterday at 6:30 p.m., the Maine CDC laboratory had received 1,018 samples just yesterday alone. And that was a cutoff time of 6:30 p.m. We understand that additional samples arrived after that time period. So our laboratory is now processing what we hoped would happen, which is the maximum number of samples that we can accommodate per day. We're not stopping there. We're continuing to look for opportunities to expand our laboratory testing capacity at the state level, as well as working with others like hospitals and commercial laboratories to see what more they can do to offer testing across the state. Finally, an update on the vital assets that we track on a daily basis. Overall, there are 392 intensive care unit beds across the state, 164 of which remain available. There are 318 ventilators across the state, 248 of which remain available, and there are 439 alternative ventilators. Next, I'd like to provide a quick update on the public health aspects of the work that the Department of Corrections is undertaking to swab and send samples for all of the individuals associated with the Maine Correctional Center. As of 10 a.m. this morning, there have still been no new positive results other than the original positive result associated with the Maine Correctional Center. Again, as of 10 a.m., the Maine Department of Corrections had received almost 250 samples results back, all of which were negative. They have almost finished the process of collecting all of the swabs, and by the end of today, we'll have tested the entire campus. Those results will be coming back to them on a rolling basis, and again, other than the original positive test, all subsequent tests have come back negative. Before I turn things over to Governor Mills, I would just like to take a moment to acknowledge that this is the end of National EMS Week. I'd like to thank each and every one of our emergency services personnel across the state for the service that they've shown, not just during the COVID-19 epidemic, but well beyond that, well before that, and certainly well after. The jobs that EMS providers do, the professionals that they are difficult enough on a daily basis, but even more so during this time of COVID-19. In my world, my view is that there's nothing that can mean so much as a heartfelt thanks. And so I'd like to take this moment during National EMS Week to thank each and every EMS worker across the state for their service. As someone who's recently had to come into contact with the EMS system, I have nothing but the best to say about them, and really truly do thank them for each and every hour of service that they provide to us. So with that, I'd like to turn things over to Governor Mills.
Thank you, Dr. Shah. It is indeed a weekend for gratitude in general. This weekend is Memorial Day. Before we all go out in our backyards and enjoy the sunshine and fresh air to the extent that we can, the fresh air and sunshine we all so greatly deserve, I want us all to pause and remember the good, the courage, and the grace of our nation's past. In solemn remembrance of the men and women who have faithfully served our state and our nation in the armed services, and especially in honor of those who lost their lives to preserve our freedoms, I am directing that all flags be lowered on Memorial Day, May 25th. I've also directed that the flags be flown at half-staff from now till sunset this Sunday, May 24th, in honor of our 75 victims of the coronavirus pandemic including many who were veterans of the wars that were fought to protect our liberties today. 2020 has been an extraordinarily difficult year to date for our state and for our country. There is pain, there is illness, there is death, there is unemployment, financial loss, and unprecedented economic hardship. But it is on Memorial Day as well that we remember how much else we have gone through and been through, that we have endured before, that we survived, and how we will survive and rise again. This year is also the anniversary of other more difficult struggles and difficult years as we mark the end of so many past battles. We remember 45 years ago, a war that ended without fanfare, parade, or glory, as South Vietnam succumbed to shelling and invasions from the north. After flawed negotiations, defections, and defeat, and a finale without celebration, to a war which had deeply divided our nation and which saw 48,000 young men and women from Maine go to that far-off battleground, which took the lives of more than 340 of them. We remember this weekend as well the 67th anniversary of the end by truce or armistice at Panmunjom of an isolated conflict in Korea called the Forgotten War, which had lasted 37 months and which took the lives of more than 33,000 Americans, including at least 244 Maine soldiers. And 75 years ago this month marked VE Day, the fall of the Third Reich, the end of the war in Europe, and later that year, the end of the Second World War, in which 80,000 Maine people served, 2,156 perishing in battle. I think of the hardships our men and women faced with uncertain fates, and the beaches of Normandy, the fields of Belgium, the storming the hostile Pacific Islands, 7,000 miles from their homes in Maine. Memorial Day brings respect and a sense of history as we honor those who perished to preserve our country and to protect our freedoms. It brings grief for the families of those recently lost, and an especial grief for the at least 10 war heroes whom we have lost recently to this deadly virus, and whose families are unable even to celebrate their lives. Those who are among the more than 94,000 Americans who've died from COVID-19. When I think of those who served their country, I think of the courage they showed in the toughest of times. Those Mainers served and fought with determination and great hope for our collective future. A determination that I feel and respect today, and a hope that I feel again today. 75 years ago last month, towards the end of the Second World War, we lost one of the most vital people of the 20th century, the man who prepared our country, a country that was woefully unprepared to do battle for the greatest war of the century. A leader with foresight and fortitude who energized our nation and steeled us for unprecedented and unexpected battles. Franklin Delano Roosevelt led us out of the Great Depression and led the American people through war, calling on us to speak with one voice, one heart, with determination, decisiveness, and dignity, demonstrating exactly what our nation is capable of when circumstances require, when we fight against formidable odds. FDR was a man who, more than any other, shaped and directed our moral, social, and economic fabric, a man who gave us the safety nets of Social Security and unemployment on which we rely so much today, a man who gave our nation hope. The odds we face today are great as well. We know what to do. We're not raising rifles and bayonets or dodging landmines or dropping bombs on an enemy whose face and flag we know. We're not walking into battle in foreign fields and forests. We're facing an enemy that is real but unseen. as sure a killer as any enemy we have ever fought in our national history, an enemy that has killed more than many of our veterans and has just infected another 71 Maine people and claimed the lives of 2 more. We're fighting this foe as a nation and as a state, not with bullets, but with hygiene, not with soldiers huddled in bunkers, but with social distancing everywhere we go, not with torpedoes, but with face coverings. These are our strange and novel armaments, our sure and only ammunition against this enemy, and we are all soldiers in this fight. We arm ourselves this way to protect ourselves and equally to protect people whose names we do not know. The people we meet on the street, the folks who work in the restaurant, the store, the packing plant, the nursing home, the nurses, doctors, and CNAs caring for the sick, the veterans who deserve to live the remainder of their heroic lives with health and happiness, not to be felled by a painful contagion far from family and friends. We face great odds this year, as we did 75 years ago and 4 years before that. But we have the same hope, the same faith in the future, the same commitment to community that drove our predecessors not only to survive, but to rise again, a unified nation. The hope of our past and the faith in our future are with us this Memorial Day as we raise our heads high, as our souls rise, as we show with these simple measures our love for our neighbor, our respect for the freedoms and safety of all citizens, our great love for this state, our love for our nation. Wear the mask to show that you care. Wear the mask with pride in honor of every veteran, in honor of every patriot. God bless you and God bless the state of Maine.
Thank you so much, Governor. Thank you very much. We will now turn over to our colleagues in the media for some questions. This afternoon's first question goes to Megan from WMTW.
Thank you, Dr. Shah, for taking my question, and Governor Mills as well. I actually have 2, if I may. The first question is, we've talked about universal testing at length, and just testing in general, really at length. And you mentioned that now universal testing is in place at congregate care facilities after 1 case is detected. Not to get too technical, but some in our congressional delegation have called for universal testing without even having 1 case present, testing weekly or even bi-weekly if that's possible. Is that something that is possible? And what would it take for Maine to get there? I assume from your answer, Dr. Shah, or what you were talking about earlier, that we're on the path, but how long until we get there? And is that something we can do?
Well, so Megan asks about what's next after universal testing where there's been 1 case, and what are the pros and cons of moving toward universal testing when there haven't been any cases at all? And there are a few pros and cons. The pro is, of course, we get a snapshot, but the con is that the snapshot is just that. It's a snapshot of a very, very fast-moving train, and a snapshot that really only tells you what may have happened 3, 5, 7, 12 days ago. The other considerations that we have to think about in congregate care settings, especially long-term care, or in this case, in a memory care center, is that the process of testing is one that can be uncomfortable. And for many elderly individuals, especially those suffering from dementia, can be downright bewildering. We've got to take that balance into account. Not long ago, I spoke with some medical directors of long-term care facilities who expressed reservations about that for that reason. The other final consideration we have to take into account is, what do we do with the negative result? Again, the test results are just a snapshot of a very fast-moving train. A negative result only tells you what happened at that moment in time. Unless we're prepared to take strong action based on those, which may not be accurate, we've got to think through all of those eventualities before we go down that pathway. So this is another example of where I like to have everything thought through all the way to the end game before we make our first move.
And to build off that last question, sort of like a follow-up, if I can, if you were talking about, Cape Memory Care Center and congregate care facilities that handle and take care of people with dementia, and how important it is for them to have certain levels of care, and what are the particular challenges, the unique challenges of the nature of these kind of patients, as we navigate how and when we handle COVID-19 testing in these types of facilities? Is there any kind of guidance to these long-term care facilities about how you handle specific patients that have these kinds of needs?
Mm-hmm. So Megan asks about patients in long-term care facilities or any congregate setting that may have additional needs. And Megan, I'm glad you asked that. In any situation of this sort, whether it's an outbreak or not an outbreak setting, we're always putting the patients first. That's always our primary goal, and making sure that we approach anything we do through the lens of what's best for their welfare. The questions you ask are good ones. This is really what geriatricians do. And it's why, as we've been thinking about more widespread testing, we've been careful to consult with geriatrics experts, because they approach things not just through the lens of clinicians, but with a specific focus on the unique needs of individuals who are older, who may suffer from dementia, or who may have other needs associated with their older age. Specifically for individuals suffering from dementia, it may be more challenging for them to have a sense of what's going on in terms of abiding by social or physical distancing. Wearing a face covering, which is easier for some folks, may be more of a challenge for them. It's also important that just because they're suffering from dementia, they don't lose all their rights. They need to know what's happening. And if we're offering them a test, we have to make sure that if they don't want that test, they're empowered to say no. So we have to make sure that we're taking into all of those things into account. That's one reason we've consulted with geriatrics experts, especially those that run and serve as medical directors of these facilities. I've had the opportunity to chat with a few of them, and there's a diversity of opinions. That's why we seek out those opinions in these difficult situations. Thank you very much, Megan. I'm going to turn next to Steve Betts from the Courier-Gazette.
Yes, thank you, Dr. Shah. I have a question for Governor Mills.
Mm-hmm.
It's concerning the inmates who have received unemployment benefits, including the pandemic additional benefit.
Right.
So the Assistant Attorney General said that this was legal. So what legal reason is it to not give those inmates the benefits?
Well, thanks for the question. First of all, I certainly support work release programs. I think they provide a great benefit not only to the inmates who are perhaps towards the end of their sentence, but to the employers and the local communities who have needed that help. And I think it's productive and it's a rehabilitative tool, but I also believe it's a privilege and not a right. I was also surprised to learn that inmates were receiving unemployment, particularly the additional pandemic unemployment assistance, the $600 a week, which is intended to support those who are living on their own and taking care of families and don't have somebody else to pay their room and board. Obviously, inmates are cared for, their room and board is paid for by the state. And that concerned me, that they were receiving those benefits, the underlying unemployment and the additional $600 a week, and I've asked for it to stop. That's about it. I just think it's bad public policy.
Great, thanks, Steve. We're going to turn to Kevin Miller at the Press-Herald next.
Great, thank you very much. I guess first for Governor Mills, just want to get your latest thoughts on kind of where we stand on the with the cases that we've had, the additional outbreaks, kind of where we stand on, in your eyes, in our reopening plan. Are you still comfortable with where we are? Is your administration looking at changing anything, especially for the community transmission counties?
Thank you, Kevin. We're constantly looking at protocols, checklists for every sector. I think we've looked at about 70 different sectors of the economy, and including the rural counties. And we just had the first death in Aroostook County, one of those 2 deaths that was reported today. So nobody's immune, no county is immune. We've tried to balance the economic impact of the executive orders and of the pandemic generally with the dire public health needs of the communities. The economic impacts are varied, and they're not simply because of due to the executive orders or the stay-at-home orders, those kinds of things that almost every state has been using. They're also due to changes in consumer confidence and consumer spending, travel, and the lack of airline traffic, H-2B visa program, the Canadian border being shut down, so we don't have the Canadian tourists coming down through 201, et cetera. A lot of things are impacting the economic analysis of the pandemic generally. So we are trying to balance all of that. And our public health people, talking with industry members and representatives of every sector of the economy, have come up with these checklists. So when we say we're reopening, we say we are actually allowing certain businesses, certain types of business, to do business, hopefully in a financially stable or a viable way, but with specific public safety enhancements and conditions so that consumers can be confident in going there, so that staff will be confident in coming back to work, of going to work there. All those things are in the equation. So yes, I continue to be confident in the judgment of our public health experts and in the analysis of Commissioner Johnson and her staff, who continue to listen to hundreds and hundreds of voices every week, who have come to the table not only to say, please allow me to do business, but allow me to do business in a certain way. Here's how I can do it safely. We are listening to those voices every day.
Great, thanks, Kevin. Yep. Go ahead.
Shah, I have one question for you.
Yes, please.
So I think we all periodically get questions from people asking why can't we reopen the parts of the state, especially the rural areas that don't have many cases, and still protect these vulnerable populations in nursing homes and long-term care facilities. We still are seeing a lot of pockets in the communities with the counties with community transmission. But as an epidemiologist, kind of what's your response to those things? That why can't we loosen things up more and even open the state fully while still protecting these vulnerable communities?
So Kevin asks about with respect to reopening and the linkage between reopening and the possibility of putting individuals who are medically vulnerable, who are in congregate living settings like nursing homes, possibility that could put them at more or greater risk. And Kevin, I think the shortest answer is that there seems to be some emerging data that I've heard about and have not yet had the chance to. I don't know if it's been fully peer reviewed, but there seems to be a strong linkage between the background rate of COVID-19 in any particular population and the likelihood that there might be an outbreak at a nursing facility. And so that's one reason why, although there have been concrete steps that have been taken toward moving and allowing certain establishments in rural counties toward reopening safely, there's still some cautionary notes. We still continue to see outbreaks that are popping up predominantly in congregate care settings. And if there were more widespread reopening at a pace that outpaced what the virus could do or what would be safe, there remains the likelihood or the possibility that someone associated with that could be affiliated with the nursing home. Could be an employee, could be someone else, and then we could generate outbreaks in those. Now, that's a lot of ifs and a lot of maybes. So we're not just looking at models, we're also looking at the data as they exist in Maine right now. A lot of the growth in the past week and a half that we've seen has been within counties of existing community transmission, as opposed to counties where it hasn't existed. So it's a little bit of both. On one hand, there's this continuing risk that's been talked about in the literature that higher rates of cases could lead to outbreaks in nursing homes. But on the other side, we haven't seen those higher rates of cases yet materialize in Maine in rural counties. We're still doing more testing in those counties. So I think for that reason, the bottom line is that it's too early to tell.
Maybe I could expand on that if you
Yes,
don't mind,
absolutely. Of
Dr.
course,
Shah.
Governor. Yeah.
When we talk about high-risk populations and we talk about vulnerable people as if we can put a scarlet V on someone's forehead and say, you should stay home. Let me get back to basics. Maine is an older state. 22% of our entire population, wherever they live, in or out of a nursing home, in a rural county or an urban county, 22% of Maine people are over the age of 65 or 65 or older. 33% of Maine's population have high blood pressure, another vulnerability. 11% have diabetes. 11% have asthma, particularly children. We have a very high rate of asthma among children. 6% are immunocompromised in other ways. 42% have some degree of obesity. All of those factors make those people vulnerable. That is a huge, significant portion of our population. We're not just talking about people in nursing homes. We're talking about the entire population of the state of Maine. And pretending, and as some have suggested, that vulnerable people can just stay home and people with vulnerable people in their families can just stay home, as some of the informal guidance has suggested, is not realistic and is not fair. It's not fair to those people and their families. We all need to protect the vulnerable people in our society.
Thank you, and we will turn now to Amy Brown at WERU.
Thank you, Dr. Shah. I have a question for each of you today. Governor Mills, people are exploiting your medical exemption to wearing masks, and they're coaching others to do the same. Store employees across the country have been assaulted and in some cases even killed trying to enforce the rules about wearing masks. Is there anything else you can do about that situation? People have to have those cards in their cars to park in a designated parking spots for accessibility. Maybe something along those lines?
Yeah, we haven't got there. We have not discussed that. At least I haven't. It would be kind of difficult to provide that kind of a medical exemption card. Like some people have that exemption card for wearing seat belts because they have a certain abdominal issue. Pretty difficult to do when you got 1.3 million people here in the state of Maine, plus an expected nearly 10 million coming to the state of Maine, possibly in the next few months. So I would not suggest that's a practical solution. I'm sure there'll be a few people, there'll be some outliers in every one of these areas who say, just don't want to wear the mask, I'm going to say that I have a breathing problem or some such thing. But to those people, I say, think of the person next to you. Think of the person who may be walking down the beach not far from you. The person who's dining across the way in the same restaurant. The person parking their car next to you. They may be a veteran. They may be a person with asthma. They may have a small child with asthma or diabetes, and you're putting them at risk. Just think of one another. That's what I ask those people to do.
Dr. Shah, in situations where people have contracted the virus through community spread, are the contact tracers asking about whether they have attended large gatherings or are otherwise following the safety recommendations? And if they are, what are they finding?
So Amy asks about what the nature of contact tracing is when an individual is thought to have contracted COVID-19 in a community setting, not having had direct connection or direct link to a known case. And Amy, your hypothesis is correct. We use a very long questionnaire that asks confirmed individuals everywhere they've been in the preceding 16 days to look at where they may have visited and whether any of those was a congregate setting or any kind of setting where other people may have come into close contact. Maybe it was a large gathering, maybe it was a small gathering. And thus far, we haven't really identified much in the way of communal large gatherings, but that's because for the most part, there are no communal large gatherings right now. Much of the community transmission that's been detected, we haven't identified where it may have come from. That speaks to the need directly to the need of what Governor Mills just noted, which is by each of us wearing a face covering, we can reduce the likelihood that that community transmission occurs in the 4 counties in which it has occurred. As we've talked about during these meetings, what the face covering does is protect other people from you. And what their face covering does is protect you from them. If we all were wearing those coverings, the likelihood of incidental or community transmission would go down. I'm going to turn next to Kit Harrison at Mjumbo, Africa. Kit, we're going to take a question from you if you're available.
Hi, Dr. Shah. Good afternoon. Let's see. As has been discussed here before, people of color in Maine are getting ill from COVID-19 at strikingly high rates when you look at the percentage of the total population. Could you speak a bit about your understanding of the kinds of factors that are causing people of color to get sick at such high rates? And what would you say to those who might look at this data and conclude that blame for the problem rests on the communities themselves?
Oh, well, okay. Well, let's take that one squarely at the outset. And Governor, can I turn that over to you first?
You know, I think we've said it before. This virus is race blind, ethnicity blind, religion blind, color blind. This virus doesn't know your political party, your geography, doesn't know what country you came from or how long you've been here. This virus is an equal opportunity destroyer.
I completely concurred, Governor. The notion that any one individual, let alone a group of individuals, is to blame for contracting a virus that's out there in the community, in the air around us, doesn't really pass any scientific muster whatsoever. Now, you know, Kit, you asked about some of the factors. There are a number of factors, but I'll highlight 2 that are of concern and that we're trying to think through more carefully. The first is the nature of the employment that many individuals of color have. What we know is that the nature of that employment often puts them in the direct line of the virus. They're forward-facing, customer-facing roles. Secondarily, the nature of that employment often means they can't work from home. That's one set of factors. The other set of factors that we are working really closely on is lack of access to healthcare. It's all well and good to say that our laboratory will run samples. It's all well and good to say that providers have swabs, but if you don't have a primary care physician, a lot of that bridge is one that's difficult to cross. So we've been working with providers across the state, particularly in areas of the state where we know the problem to exist, to try to see at a minimum, how can we arrange for testing even if someone doesn't have a primary care provider? Because we know even that hurdle can be a very significant one. So that overall architecture of making sure there's greater access to healthcare, whether it's primary care, testing, and follow-up, is a big goal that's right in front of us right now. So,
and we are paying for testing for those who are uninsured.
That's correct.
Medicaid funds.
That's correct. I'm going to turn next to Lee Nelson over at News Center.
Thank you for taking my call. Can you hear me?
Lee, the volume is very low.
About now.
Still just above a whisper.
Coming in.
All right, there we go. How about? All right, there we go. How about?
Whoops.
Well, I'll shout.
Shout.
I have 2 questions for Governor Mills. The first being, there's this $1.25 billion in federal funding from the CARES Act available, and I know your office and lawmakers both requested flexibility on how that money can be spent. But can't some of this be distributed to towns and cities that have already been spending a lot on COVID-related services, buying PPE, adding staff, things like that?
I think the question, thank you. I think the question was about the $1.25 billion in the CARES Relief Fund, and talking to lawmakers about that, and can't some of that money be used, you're coming, for local municipalities and PPE and such? We have these weekly calls with the president and or the vice president and Secretary Mnuchin, where we, the 50 governors, continually discuss the availability of that fund, what it's to be used for, and how we can distribute it. Once we get that guidance, and I know other states have done some different things, but I don't dare use it. We have not used any of it until we get full guidance from the federal government. And we are also talking to the congressional delegation and watching what happens in the Senate. There are, I think, 4 bills now in the U.S. Senate, plus the one from the House, that, among other things, will untie our hands with respect to that money. Right now, it's very limited. What we're told is we can only use it for COVID-related expenditures, not for backfilling anybody's budget, whether it's town, county, or state, or private subsidies. And once we get that full guidance, and once the Senate acts within the next 2 weeks, I believe, we will know a lot better about what we can do with those funds. Hopefully, help out some business enterprises. Hopefully, help out some towns and cities, and work with the Appropriations Committee in the coming weeks to get their input on what we can and should do with those funds.
Great.
Okay, and my second question has to do with fitness facilities. I know there was a big Zoom call yesterday morning with a whole lot of the fitness owners around the state. Many of them have already moved their, spin classes and aerobics classes outside as per regulations. But in looking at the study that you cited when you pushed back the opening for gyms and fitness facilities, a lot of it did have to do with these small enclosures, spin classes, aerobics classes, and a lot of these places are gigantic with 30,000 square feet of weights. And a lot of these owners are asking, can't we open these giant spaces up with certain precautions in place? And they say they'd love to get an ear with you just to talk about this a little bit more.
I know they've been very vocal. I was not on the Zoom call yesterday. They've been very vocal. We have a subgroup working on things like gyms, summer camps, we've just come out with guidance. Every one of these sectors, these types of businesses, requires a really deep dive by public health professionals and people from the industry. Right now, we're not as confident as the gym owners and managers are about keeping people safe in a gym that, by definition, requires a lot of heavy breathing and sweat and exercise and the kinds of activities that do tend to spread a virus. And it's so highly contagious. I think, do you want to add anything to that?
No, I concur, Governor. There's still more science that's being done, but based on what we know right now, it's difficult to quantify what that risk is. And given what's at stake, there's definitely a risk. So thanks, Lee. We're going to turn next to Patty White at Maine Public.
Hi, thanks so much. I've got a couple of questions, and one is about the 2 types of tests for COVID-19. This week, the U.S. CDC acknowledged that it's combining the results from the PCR viral test and the antibody tests, and there's concern that doing that could provide an inaccurate picture of the coronavirus, and it could artificially skew the positivity rate lower. And I know in Maine that the CDC separates those 2 types of tests out into different categories on the website. But when you're calculating the positivity rate, are you separating them or are you combining them?
Great. So Patty asks about some recent reporting that's been done at the national level, suggesting that the U.S. CDC, not the Maine CDC, the U.S. CDC has been inappropriately combining the 2 different types of tests there are for COVID-19. Patty, as you correctly note, on our website, and when I read off the weekly testing numbers, we are always careful to separate those 2. They tell you, what the numbers tell you are two different views of potentially the same scene. The PCR test, the viral test, tells you what's right in front of you, right in your windshield. The antibody test is a better picture of what's in your rear view mirror. But combined, they do give you a good and accurate picture of what's happening not just now, but over the past several weeks. When we calculate positivity rates, we calculate positivity rates for both. Although we also report a blended positivity rate, we separately and simultaneously calculate a positivity rate for both types of tests. As it turns out, in Maine, those positivity rates are almost identical, 5.5%, 5.4%, for a blended positivity rate of 5.4%. So we do calculate all of those because we want to be clear about what the data show. But the honest truth is that they both tell you a different piece of the overarching or ongoing COVID-19 piece.
Thanks very much. And then I had a question about the reopening plan, and specifically about the opening up gatherings to 50 people or less, or fewer than 50 people. That's coming in just a week and a half.
Yep. Yes.
Is that still the plan? And why is it okay to make? That's a big jump from limiting gatherings of 10 people to go up to 50. So why is that okay to do that?
Well, it's not just gathering 50 people, it's how you do it too and where you do it. We're still requiring a social distancing, wearing masks. Now, and we're expecting people to all wear the face coverings whenever they're out in public and whenever they could become in close contact with other people, which is fairly often. We're asking that people do all of those things and wash their hands regularly, 20 seconds. Engage in good hygiene. Those things all stay in place. And we're watching the numbers. We hope that increasing the number of people allowed at a particular gathering will not change the figures that we're getting, the data that we're getting. But it's part of the gradual reopening effort as we watch every day how things change.
Thanks, Patty. We're going to turn next to Emily Tadlock at WABI.
Hi there. I have a question for each of you today. I'll start with Governor Mills. President Trump announced today, just not too long before this briefing started, that he's designating houses of worship as places that provide essential services. And he's calling on governors to allow them to open, and says if they don't, he'll override them. I know currently right now on the DECD website, the religious gatherings checklist hasn't been updated, but it was supposed to be updated on there today.
Yeah.
Just wondering what you have to say to that, and if you think you'll be opening things up earlier.
I have no idea what President Trump said about religion or religious gatherings. We've been working on that issue for a couple of months now and have been dealing with our main church groups and associations. The Bishop of the Diocese of Portland, the Maine Council of Churches, the Christian Civic League, and others to develop guidelines so that, first of all, they can have drive-in outside services, and many churches have been doing that. And we have redrafted some protocols that should go up today regarding inside worshiping in those houses of worship which choose to be inside, retaining the outside, the drive-in, car-based worship service as another form of worship as well. So yes, we've been working on those guidelines.
And Emily, you mentioned you had a question for me as well.
Yes, I did, actually. I had a viewer send me a message, works for a hospital, it's a critical care nurse, and says many people are saying COVID-19 is no worse than the flu. So, I know you've answered this question before, but now that we're in this even further now, what is the death toll from both nationally, and how do the case numbers compare to one another?
Well, there's a lot of, so Emily asks about how COVID-19 stacks up against the flu, seasonal influenza. And both are very serious diseases. Both cause an immense amount of mortality. What we know thus far about the two diseases is that they're both really serious. COVID-19, even with all the data that we've got thus far, appears still to be a good deal more fatal than even the seasonal influenza, which extracts a significant death toll across the country every single year. And COVID-19 is worse than that. Now, how much worse? There's a lot of scientific discussion out. Some studies put it at 10 times as worse. Some have it as only 5 times as worse. But if you think about the fact that just so far, COVID-19 has caused the passing of over 90,000 people across the country, the numbers are staggering. Now, how it stacks up to seasonal influenza, what we may know in a couple of years when more data come in, might be that it's somewhere in between. Perhaps it's not 5 times as bad, maybe it's 7 times as fatal. Each of those numbers, though, is staggering compared to a disease like the flu that is already very fatal. What's really important to note is that the fatality rate, albeit very important, only tells you a part of the story. The other part of the story is how easily can it be transmitted from person to person to person. And there, COVID-19 strikes a pretty unfortunate balance. COVID-19, it seems to be 2, if not 3 times more spreadable than the flu. So when you put those two things together, you've got COVID-19, which is anywhere from 5 to 10 times more deadly than the flu, and can be transmitted anywhere from 2 to 3 times more easily than the flu. When you put those two things together, you've got what we have right now, which is a global pandemic. And the last question for today goes to Lori from the BDN.
Hello, I have a couple questions for each of you. First, for Governor Mills, knowing that vacationers have had plans in place probably since last fall and others are trying to make plans now, when does the state expect to make a determination on quarantines for July and August?
Well, it's a good question. We get that asked every hour, and we're working on it. There is, as yet, no good alternative to the 14-day quarantine in Maine, which is the biggest tool we have, really the only tool we have to prevent the spread of the virus from people coming from hot spots, states with high incidence, to our state. So we hope they'll maintain their reservations, that they'll stay safe, that in the coming weeks we will have a more robust program for testing. In an ideal world, we would have testing at everyone who crosses the border, but even then, the test may not be valid for long, or maybe a false negative. In an ideal world, every business would have a forehead thermometer, but those are not readily available, and I am working with the federal government to encourage the production of those for businesses and governments as well. In an ideal world, we would be able to take temperatures and pulse and make sure and inspect every business, every lodging, every restaurant, every public place with public accommodations. Those are not practical solutions at this time, but we're working on every aspect of that. Working with local public health officials and code enforcement officers, with a health inspection program, with state licensing people to make sure we get the word out. Training of staff in the lodging facilities and restaurants who really wish to open. That's a very important part of the problem too, part of our challenge.
Might you consider changing the definition or modifying the definition of a quarantine so visitors to the state could access essential services and perhaps recreational areas like state national parks, as long as they had PPE and practiced social distancing?
Well, it's a nice idea, but it invites an opening of the door, and it invites a weakening of the rules that are all intended to protect our health and safety. I would be very cautious about doing that because of the likelihood of social distancing being ignored, basically, foregoing that basic precaution that is saving us a great deal.
Do you know what the traffic is looking like this weekend so far in terms of out-of-state visitors?
Do I know what the traffic looks like? I do not.
Yeah,
I have not checked. I'm sure we'll find out. I don't know what it looks like yet.
Okay. And the question for Dr. Shah, there was a report in the publication Stat today that quoted a lot of virologists basically saying that we as a whole may be overestimating or over-expecting on the power of what a COVID-19 vaccine might deliver, that it might be more like a flu shot that either helps ward off the flu or diminishes symptoms rather than, a single injection that's a cure-all. Which, if that happens, if we get a shot that's more like a flu shot, would that be enough, do you think, to feel comfortable that the public is protected adequately?
So Lori asks about the status of the science around the vaccine development. And there's a lot of research that's underway right now at academic centers and research laboratories across the country. What's not yet known by the scientific community is what any vaccine will look like. Whether it will be a shot where you get it once and you're protected for the rest of your life, whether you need to get a couple of them in a series like the hepatitis A vaccine and then you're good to go, or whether it will be like the flu vaccine, where you'll need to get it every year, and the variability, the efficacy may vary from year to year to year. Part of it depends on the science, a lot of it depends on the virus itself. The hope, of course, is that it's a one and done type of vaccine, and that one dose provides and confers protection for a long period of time. But let's assume for a second that it's closer to the flu shot, which means you might need to get it every year. Maybe we'll try to combine it with the flu vaccine, so you can get a 2-in-1 dose. But even the flu shot, which varies from year to year, can provide effectiveness of protection of 30 to 50 up to 60% some years. That's a pretty good deal if you ask me. You stop by your physician's office or a pharmacy, you spend 5 minutes getting your shot, and it reduces your likelihood of getting a disease or spreading it to other elderly or vulnerable people in your community by up to 50%. That is still a significant leap forward from where we were this past winter. So, Governor, that was the last question. I'm going to turn it over to you.
Okay, well, thank you. Listen, I just want to wish everybody a good weekend. Enjoy some sun and fresh air. Be socially distant. Wear a mask. Buy local, shop local, stay local. Our main businesses need you to be there, to purchase their services and their goods as much as you can. With the disparate impact on the tourism industry right now, I'm asking all Maine citizens to be conscious of the power of their dollar in helping the local economy. And Dr. Shah, I was given these came in the mail yesterday, one for you and one for me. I believe they're, in part in honor of Memorial Day.
Yes.
So these lovely masks are to help celebrate the weekend and keep safe.
Thank you. Thank you, Governor.
Thank you, Dr. Shah.
We'll wear it with pride. Thanks, Josh. Thank you again.